Hi, I'm Steve Selig, the founder of Fit Test, and this is part 4 in a small series on atrial fibrillation and exercise. In part 4, which is this video, I'm just going to talk about some of the literature that's relevant for exercise professionals. So first of all, we in exercise, when we're dealing with people with atrial fibrillation, we have to be thinking about rate control. Now, what I'm talking about here are people who are in atrial fibrillation when they present to you. So we know they have the arrhythmia. That's not in question. What is in question is there sufficient heart rate control to make exercise safe? That's the critical element, talking point. Now, about 10 years ago, there was two papers published in the absolute top journals, the Journal of American College of Cardiology and the New England Journal of Medicine. And these papers address the issue of what's called lenient rate control. That is where they looked at the endpoints or the outcomes of cardiovascular illness, hospitalisation, and even death. They looked at those as the outcome measures for people that have so-called lenient rate control, where there is more tolerance over the resting heart rate, in this case up to 110, versus strict rate control, where the heart rate is controlled to less than 80 beats per minute. And I'm talking about rest, but it has implications for exercise. Now, what was shown here in these really important studies is that we don't have to be too obsessive about the rate control at rest, that we can still exercise people safely who have rates even above 100 beats per minute at rest, knowing that they're in atrial fibrillation. But there's one major qualifier here, and that's this. And that is, if someone presents to you and they are likely to be in newly occurring atrial fibrillation, in other words, it's not on the referral, the primary care medical practitioner and any other health professional doesn't know about it. The client probably doesn't know about it, although they may well be experiencing some symptoms. So if you assess your client as having new AF, do not exercise them. That's my strong advice. And you need an urgent referral because, as I said in another video in this series, it's not possible to know just from this whether someone has been in AF, atrial fibrillation, for quite a few days or longer, in which case they may be at risk of stroke. So it is really important that you get these people back to their primary care medical practitioner. Now, moving to another concept altogether, and that is the so-called triggers of atrial fibrillation. Now, these are people who already have atrial fibrillation, so the underlying cause is already there. I'm not talking about the cause in this section. I'm talking about what can trigger. And exercise, for example, can trigger atrial fibrillation in certain people. And one exercise that one mode of exercise is being looked at is swimming. And this includes even horizontal swimming, freestyle swimming, surface swimming versus deep water exercise. And the reason may be related to the fact that swimming is weight-free, it's horizontal, there's a lot of upper body exercise, and all of these things can help to promote venous return into the right heart and then into the left heart. And this can cause some acute stretch on the upper chambers of the heart, which can then maybe trigger atrial fibrillation. But hopefully your clients will be able to tell you if they've got exercise triggers and you can just avoid them. This is not a reason not to exercise people in atrial fibrillation. It is just a reason to avoid those forms of exercise and those trigger points. Now, alcohol, there's been really interesting findings here. And again, I want to emphasize that this is in people with atrial fibrillation already. And there's been some very recent study led by Alex Voss-Gaboynek in Melbourne, Australia, who did a really nice randomized controlled trial on moderate alcohol intake. This is not binge drinking or large levels of alcohol intake, but moderate levels of alcohol intake can trigger atrial fibrillation in people already with atrial fibrillation or with episodes of atrial fibrillation. So this is really an important finding, and I think you need to advise your clients who are drinking maybe excessively, who are having episodes of atrial fibrillation, to restrict their alcohol to maybe 1 to 2 drinks or 1 to 2 drink sessions per week, and not drinking every day. Binge eating, especially high-fat foods that we know triglycerides in the blood can stimulate arrhythmias or rhythm disturbances in the heart, and emotional stress can do that as well. I've given you a few references. So moving on, patients with atrial fibrillation are, of course, have some natural anxiety that the exercise may induce further episodes of atrial fibrillation, and therefore they may be at risk of a sedentary lifestyle just due to their anxiety. And this really relates to the point that I made on the last slide. So we need to find modes of exercise that are not triggering where we can, and that might be a bit of an exploration exercise for you and with your client. But if we can find modes of exercise and intensities and volumes of exercise that don't trigger, then we can get our patients fit, and that's certainly a goal. And there's an emerging evidence which is sort of related to this, that that there is a lower atrial fibrillation burden, in other words, occurrence of atrial fibrillation in clients who already have atrial fibrillation, or at least episodes of atrial fibrillation, if they engage in aerobic training. So find the mode of aerobic training that doesn't trigger, and this may protect your clients from future atrial, or at least reduce the burden of atrial fibrillation. So these are strong findings. Moving on, patients with atrial fibrillation are at risk when engaging in high intensity exercise, including high intensity interval training, but not low intensity or moderate intensity exercise. Now, I know some of you will be looking at this and will be very enthusiastic about applying high intensity training, including high intensity interval training, to as many of your clients as you can. I just want to raise a word of caution in the setting of clients with atrial fibrillation. And I've given you 2 references here, and the Wang study here is about thrombogenesis, in other words, blood clot formation, that I've been mentioning quite a lot in this series of on atrial fibrillation. Obviously, blood clot forming in the atria and then breaking off and moving into the brain and causing a stroke is a major negative outcome for people with atrial fibrillation. That's why they are put on antithrombogenic therapy, which I mentioned in another part of this series. I'm not going to talk about it again. But the point about the Wang paper, and many other papers have found similar findings from other groups of researchers, is that very high intensity exercise actually promotes the thrombogenic pathway and opposes, or doesn't stimulate in the same way, the clot dissolving pathways such as fibrinolysis. So when you go to high intensity exercise, it is pro-thrombogenic, in other words, pro-clotting. And the reason is back to, in all living animals, back to primitive reflexes of predator and prey. When the predator and prey are meeting up, as in the predator is trying to catch the prey, kill the prey, then both are under extreme exercise intensity, and both can injure each other and cause bleeding, and that's why our thrombogenic pathways are stimulated at maximal and very high intensities of exercise. So for people with atrial fibrillation, and even wider than that, people on any antithrombogenic therapy above, say, aspirin, I wouldn't worry in the setting of aspirin, but any other antithrombogenics above that level, I would be cautious with high intensity interval training and high intensity training in general. Now, the second paper by Hilliard is more about heart rate control. And as we know, if we go to very high intensities of exercise, we may lose that heart rate control, even for patients who are on drugs such as beta blockers, because those drugs have been set for resting conditions and not for very high intensity exercise conditions. So just a word of caution on using HIIT for clients who have atrial fibrillation. Now, a slightly different topic. There is no evidence that an exercise session can be used to promote reversion to sinus rhythm in episodes of atrial fibrillation, which is known as paroxysmal atrial fibrillation, or even permanent atrial fibrillation. So this is kind of the reverse trigger that I was talking about, the trigger before, that exercise can trigger. But unfortunately, there is no evidence that exercise can actually revert the person back to a normal rhythm if they are in an episode of atrial fibrillation. So I'm not saying it doesn't work, just that there's no evidence for it. So finally, here are the list of references that I used to prepare this brief video. And you can get back to me, as always, at info@myfittest.com.au. And thanks for looking at this video. Bye for now.